This is Alan Berube, Senior Fellow and Research Director with the Metropolitan Policy Program at Brookings. And this video presentation provides a snapshot of a new analysis that Brookings has conducted in partnership with the Reinvestment Fund, a Philadelphia-based community development financial institution. The Reinvestment Fund is at the cutting edge of identifying and understanding markets underserved by healthy food retailers and using public policy and private capital to overcome market barriers to supermarket development in these locations. In this presentation, I'll make three basic points. First, many U.S. communities suffer from inadequate access to supermarkets. That access is important for household well-being and community quality of life, but some locations present market obstacles to access that public policy can help address. Second, significant but variable gaps in supermarket access exist across 10 metropolitan areas we studied. 1.7 million people across these metro areas live in low and moderate income neighborhoods with low supermarket access, but their prevalence and characteristics differ between enormous metropolitan areas like Los Angeles and mid-sized markets like Little Rock. And third, a new online tool from the Reinvestment Fund's Policy Map service can help communities identify and address access gaps. This presentation provides an overview of the access challenges facing communities in these 10 metro areas. Mapping and reporting tools on Policy Map can help on-the-ground actors in these markets and others to better understand access gaps and target appropriate interventions. So let's start with the initial observation that many U.S. communities suffer from inadequate access to supermarkets. Why do we care about this as a public policy issue? Well, the benefits of supermarket access are numerous. First, research indicates that supermarkets' larger sizes and resulting economies of scale allow them to charge lower prices than their smaller footprint competitors, reducing food costs for households. Second, those scale economies permit supermarkets to offer a wider selection of goods. This includes more fresh produce that requires frequent delivery and refrigeration, and consumption of which is an important part of a healthy diet. Third, supermarkets are also an important community anchor for economic development and job growth. Research by the Reinvestment Fund indicates that underserved Pennsylvania communities in which it financed new stores typically experienced faster subsequent job growth among businesses located within a quarter mile of the new supermarket. And finally, supermarkets represent an important quality of life amenity for any community. Indeed, their presence or absence often helps to inform the location decisions of households who have multiple options in the housing market. Yet many low and moderate income communities in urban, suburban, and rural locations exhibit significant gaps in their geographic access to supermarkets. The Reinvestment Fund recently performed a nationwide scan using the same methodology employed for this report and found that 19 million residents of low and moderate income U.S. communities are located considerably farther from a supermarket than residents of similarly situated higher income communities. There are a number of possible reasons why some communities exhibit low access to supermarkets. Some research has suggested that potential retailers lack accurate information on the investment opportunities in these communities, and some groups have successfully used alternative information to ultimately attract successful supermarkets to underserved areas. Other research, including a recent study conducted by the Reinvestment Fund, confirms that supermarkets face real cost differentials when opening in underserved, mostly urban communities. These include higher startup costs for identifying and assembling urban land, training workers from the surrounding community who often bring limited local labor market experience to their positions, and investing in security necessary to prevent merchandise loss in lower income areas. These higher costs extend to operating budgets as well. Supermarkets in underserved areas often incur higher turnover among their staff and must invest more in ongoing employee training. Store maintenance costs tend to be higher in underserved urban locations as well. Fortunately, a growing number of actors are employing creative tools to overcome these obstacles to supermarket access. Pennsylvania pioneered the use of financing incentives to attract fresh food retailers to underserved communities, helping offset their higher startup costs with grants and low-cost capital. Similar initiatives have already taken shape in other cities and states, including New York, Louisiana, and the city of New Orleans, and Illinois. The Obama administration this year announced a major budget initiative aimed at increasing access to healthy food options in underserved locations, and spending bills currently before Congress would provide funding to the Departments of Agriculture and Health and Human Services for that purpose. And very shortly, the Community Development Financial Institutions Fund at the U.S. Treasury Department will announce a new funding competition, a portion of which will be dedicated to helping CDFIs finance new and expanded fresh food retailers in their communities. This prompted our study of this issue in closer detail, which leads to my second point. The 10 metropolitan areas we examined exhibit significant but variable gaps in neighborhood access to supermarkets. So what does it mean to have inadequate access to a supermarket? TRF's methodology, which is explained in greater detail at its website, www.trfund.com, measures access in terms of the distance that residents of a neighborhood must travel to reach the nearest supermarket. That distance is compared to an average reference distance for middle and higher income neighborhoods, which are assumed to have adequate access to supermarkets. The methodology compares neighborhoods that are similar in two dimensions: their population density, which reflects the size of the local market, and the rate of car ownership, which reflects households' ability to travel outside the local area to buy groceries. So the reference distance to a supermarket from a rural, low-density, high car ownership neighborhood of 8.3 miles greatly exceeds the average distance in a high-density, urban, low car ownership area of a little over a tenth of a mile. TRF then measures the distance between each neighborhood center and the nearest supermarket, shown here in green, compares that distance to the reference distance for neighborhoods with a similar population density and rate of car ownership, and rates each neighborhood by its relative access. In the final step, adjacent neighborhoods with low levels of access are merged to create low-access clusters. Within each cluster, TRF uses household income data and data from the Consumer Expenditure Survey to estimate demand for groceries, as well as the amount of potential expenditure leaking out of these communities due to a lack of nearby supermarkets. This calculation nets out grocery expenditures that occur at nearby, smaller, limited service stores, which are shown here in red. This study examined in detail 10 metropolitan areas chosen for their diversity by region, size, city age, and demographic makeup. They also include several metro areas that have emerging efforts to attract supermarkets to underserved communities. So how many people live in areas with low supermarket access? To begin, a total of 36 million people overall, about 1 in 9 Americans, live in these metro areas. About 2/3 of them live in neighborhoods defined for purposes of this study as low to moderate income. And within that 2/3, a total of 5% of metro residents, more than 1.7 million people, live in communities identified as having low access to supermarkets. Compared to residents of other low to moderate income neighborhoods, residents of low supermarket access communities are more likely to be Black and equally likely to be Hispanic. Children are more prevalent in these underserved communities, as are very low-income households, those with incomes below $25,000 annually. So low supermarket access is but one of several challenges that members of these communities may face. Looking at the 10 metro areas individually, Los Angeles stands out for having the highest number of residents of low-access communities, roughly 500,000. Baltimore, Atlanta, Cleveland, and the San Francisco Bay Area each count at least 200,000 residents of low and moderate income areas with low access to supermarkets. Of course, this doesn't control for the variation in the size of these regions. On that count, Cleveland stands out, with more than 1 in 9 residents of the region living in low access areas. Baltimore, Jackson, and Louisville also register above average shares of their populations in such communities. Where these pockets occur within the region also differs by metro area. In an older metro area with a relatively distressed urban core like Baltimore, 2/3 of low-access area residents are in the central city. By contrast, with significant swaths of moderate-income suburbs on its southern side, Atlanta finds most of its low-access residents outside the city proper. And in the Los Angeles area, underserved communities are just as suburban as they are urban. The estimated dollars that these communities lose to other areas due to their lack of nearby supermarkets is astounding. The total ranges from $48 million in Jackson to $600 million in Los Angeles annually. Cleveland also registers significant lost retail opportunity in those areas. Put them together, and the estimated retail grocery leakage from these communities tops $2.7 billion each year. Of course, much of this leakage, as that name suggests, ends up somewhere else. and may support stores and jobs and supermarkets in high-access, higher-income locations. Still, those dollars could represent meaningful economic development in areas that need such investment, and could support a store location that helps low and moderate income families save time and transportation costs. To get a handle on the more significant market opportunities that may exist in these metro areas, we look specifically at large low-access clusters. And these clusters have an unmet local grocery demand that exceeds expenditures at the average full-service supermarket. Not all low-access clusters are of such significant size, but many are. Across all 10 metro areas, we identified 62 of these large clusters, which alone could support 108 supermarkets, and thereby capture more than 70% of the total retail grocery demand currently leaking out of these communities. That brief synopsis of findings leads to my final point, which is that information to help these and other communities address low access to supermarkets can now be found online. The information is available through the Reinvestment Fund's Policy Map service, for which you can register for free at www.policymap.com. Upon registering and going to Policy Map, select Supermarket Study of Low Access Areas and TRF Study for Brookings. You'll see clusters of low access areas displayed for the 10 metropolitan areas that were the subject of this study. Typing the name of one of those metro areas into the location box at the top will zoom you into a view of that metro area's low supermarket access clusters, in this example, Cleveland. Clicking on the anchor polygon for any of those blue outline clusters produces a pop-up that provides essential details on the size and expenditure leakage estimates for that cluster. Clicking again on the PDF link in the pop-up will produce a report that provides a wealth of geographic, demographic, and economic detail on the low-access cluster, including its location, population, race, ethnicity, age, and household profile, and characteristics of its housing and workers. These details can help policymakers and community-based organizations target their efforts to underserved locations with the greatest potential for new or expanded supermarket development. Policy Map also contains existing grocery retail locations in and around low-access areas. These locations, which are licensed from a private sector data provider, and therefore only available to Policy Map subscribers, can be found in the Grocery Retail Location option on the left-hand menu. This cluster on Cleveland's east side has a number of small footprint superette stores, while the closest full-service supermarket is located several city blocks away from its outermost border. Detailed information on low-access clusters and reports on their characteristics are available for the 10 metro areas profiled in this study. However, the Reinvestment Fund has also mapped low-access areas nationwide, which you can view using the TRF Supermarket Study of Low-Access Areas option on the left-hand menu. These data provide users from communities across the country with a first-order view of the size and prevalence of local low-access clusters. They're available for big urban areas like Dallas, as well as small rural areas like southern West Virginia, each of which exhibits significant access issues. Users can employ Policy Map's many other free demographic and economic data sets to gain a better understanding of the characteristics of those low-access areas. To conclude, increasing access to supermarkets in underserved communities is a compelling goal for public policy and a compelling market opportunity for retailers. Better understanding the extent and nature of low-access communities is a critical first step toward reducing market obstacles and providing residents of these areas with better, lower-cost options for meeting their household food needs. We hope this presentation and the accompanying information at Policy Map spur informed action toward that end.